Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Have you ever hit your elbow really hard and you get a numbness or pins and needles sensation within your pinky and your ring finger? Well, that's a fairly common thing that many people can experience, usually multiple times throughout their lives. But today I want to focus in on diabetic neuropathy, or nerve pain or loss of sensation that occurs because of excessive glycation brought on due to diabetes, and talk about what you can be doing in terms of different nutrients that may be very supportive to this condition. So when we think about neuropathy as a whole, we know that this is basically defined as a disease or a dysfunction of one or more of the peripheral nerves, which causes numbness or weakness. And we oftentimes describe that as either sharp shooting pain or, as I mentioned, kind of that pins and needles, or you just lose the sensation within the area completely, which is usually a very bad thing, especially when we are in the setting of diabetics. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk a little bit about diabetic neuropathy. We know that many people who have diabetes often develop nerve problems because we know that that high blood sugar actually creates damage to the nerve cells themselves. So this is what is called diabetic neuropathy. And we can see this come out in the form of burning and tingling, loss of feeling, for example, which can make even things like driving or walking difficult because you have lost that sensation. So we know that having a healthy diet and exercise are certainly crucial, but we also realize that certain nutrients may offer very complementary health benefits when it comes to the nerves. Now, there are different types of diabetic neuropathy, which can be categorized based upon which nerves are actually affected. And when we look at both type 1 and type 2 diabetics, we realize that a good 50 to 70% of them will develop at some point throughout the course of their disease a mild or severe form of diabetic neuropathy. We know it's caused by a combination of not only the direct effect of elevated blood glucose on the nerve cell itself, but there are also other factors that play a role. So as you get older, we know that the nerves are not as youthful as they once used to be. So certainly age plays a role. We can look at vascular issues. So cardiovascular disease is also a potential risk factor for the development of a neuropathy. Things such as elevated triglycerides can certainly create havoc and also exacerbate conditions leading to diabetic neuropathy. We do know all of these different things that play a role into why it is that someone can experience this. But what we oftentimes fail to do is to go to that root cause and try to correct that. And that's a problem. Usually diabetics who do experience significant amount of neuropathy are put on different prescribed medications for the diabetic nerve pain. You've probably seen commercials on TV that target this. Gabapentin is one of them. Lyrica is another one. But we have to look at the foods and we have to remove those exacerbating components. We have to make sure that we have targeted nutrients to help to intervene and mitigate further damage to those nerve cells. So we can look at things such as LCAR, which is acetyl L-carnitine. We can look at alpha lipoic acid. We know that both of those, acetyl L-carnitine as well as alpha lipoic acid, have been shown in clinical trials to show improvement in people who have diabetic neuropathy. So the alpha lipoic acid is a very powerful endogenous antioxidant that is targeting glycation, as well as fending off oxidative stress. And then we have the acetyl-L-carnitine that is helping with the generation of energy within the nerves themselves. When we look at nerve regeneration, for example, or the reviving, one would say, of the nerves, we know that acetyl-L-carnitine certainly is going to be helpful for that. And it helps with the nerve conduction. So I'm not going to get heavy into the science on that, but we know that the acetyl-L-carnitine is going to play a quite profound role in enhancing nerve conduction. And all of this is very important when we think about the numerous amount of people that deal with this on a daily basis. We have to think about the myelin sheath. We don't want to have that wearing away of that protective covering around the nerves. And this is where your omega-3 fatty acids certainly come into play. We can look at things that can target and ease the discomfort of this. So things like curcumin, so our biocurcumin 5-loxin formulation, very beneficial for easing discomfort that's associated with diabetic neuropathy. But we also have to think of just about basic things. I had mentioned the omega-3s, but also vitamin D. There was a study that was conducted that found that diabetics who experience significant neuropathy generally have vitamin D deficiency or insufficiency. And when they gave them vitamin D to bring their levels back up to normal, they had a reduction in the reported pain. So once they balanced out vitamin D, less pain. So many times we, once again, take for granted the true role of what our vitamins and minerals are doing in the body. And we know that diabetic neuropathy, if not controlled, will get incrementally worse over time, especially if the blood glucose is not being well managed. I mean, a diabetic can be on different medications, but it doesn't mean that there's still not further damage occurring within the vascular system as well as in the nervous system. Because if they're not making those adjustments to replenish the things that are lost and to re-nourish those nerve fibers and to eat healthy, then this is certainly going to result in more pain as well as more loss of sensation and hence more and more problems. And this is really, when you look at the more severe cases of diabetic neuropathy, the reason why it's so dangerous is because if a diabetic can't feel, say, the bottom of their feet and they get a cut, they may not even know because they don't feel it. So then we're looking at the potential for significant infections. So we know that there's a lot of different mechanisms involved in the development of diabetic neuropathy. First and foremost, we have to look at glycation and recognizing that glycation is creating those advanced glycation end products, which is doing significant damage at that cellular level, especially when we're looking at nerve cells. So if it's directly affecting nerve activity, then we have to make sure that we are reducing glycation end products in the body. So what are things that we know can target glycation end products? Well, certainly we know that benfotiamine does, which is in our Nerve HX formulation. So Nerve HX is straight benfotiamine, which is vitamin B1, but it's a fat-soluble form of vitamin B1. And this is really significant when we think about what happens to the destruction of the nerve. So if we can use our omega-3s and we can use vitamin D and we can use vitamin B1 in that fat-soluble form, we can target a lot of that glycation. We can use the alpha-lipoic acid. We have to target the inflammation, which is where the omega-3s come into play once again, where your biocurcumin 5-loxin are going to come into play. But we also have to support the vasculature. So we want to be looking at things such as, once again, alpha-lipoic acid, grapeseed extract, resveratrol. All of these are important because blood vessels are just as prone to damage brought on by advanced glycation end products as our nerves are. So the more we can lower the risk factors, the more we can improve upon the symptoms that people are having. So first and foremost is the diet. Adhering to a Mediterranean diet, which is going to result in lower advanced glycation end product production in the body. But we have to regulate blood glucose at the same time. So gluco-HX, which is your blend with chromium and vanadium and alpha-lipoic acid, bitter melon extract, can help to create more stability in healthy blood glucose levels. And then we add in the omega-3 fatty acids and those 2 fat-soluble vitamins, the Nerve HX with the benfotiamine along with vitamin D3. We want to make sure we have alpha-lipoic acid and something to support the nerve conduction and nerve energy and regeneration, which is where your LCAR comes into play. So this is just kind of a basic, brief overview of what diabetic neuropathy is and what you can be doing in terms of just really basic changes that you can make in your diet, as well as incorporating in the appropriate nutrients to target that issue, because nobody wants to fall victim to loss of sensation and potential injury down the road. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.